So my name is Vicky and I'm a director of the Future Blood Testing Network. So the full name of our network is Future Blood Testing for Inclusive Monitoring and Personalized Analytics Network Plus. And so for those of you who has already attended our launching event last year, so you might already got some ideas about our network, and we have seen some new faces today as well. And thank you very much for attending. So we will also introduce our network and some updates of our network activities since we launched in October last year. So first of all, I'll introduce our core management team in our network. So myself, I'm writing as a director, and also we have 4 fantastic co-directors of Rob Barker, Mark Elliott, and Jeremy Free, as well as Sergey Korpush. Each of them are covering different aspects of the research in the network and themes. So they are going to be in the panel later on after Sammy's presentation. And also you can have a look at our website, our team information, and also we also have our YouTube video about our research and also different aspects covered by different directors. And also we have 2 fantastic network coordinators, Samantha, who we also call her Sammy, and also Steve together. So this is our core team. So this network, so it's really sponsored by EPSRC. And I think our EPSRC colleagues, I heard Alexandra also be here, I hope. So we're funded by EPSRC Research Council, and we are aiming to address the grand challenge, especially in the transforming the community health and care. So it's really about how could we facilitate, how could we accelerate development of the future of the blood testing, because the reason why we're focusing on the blood testing, because it is one of the most important type of the medical test, and also to assess the different aspects of health status. I think most of you know that blood test result that most of the time inform, I've seen a research thing inform like more than 70% of medical decision making, and there are a lot of blood test results available, like about 100 blood test results, and also around like 95 clinical pathways really rely on the patient having the more effective and efficient, timely, and very cost-effective pathology services, which including the blood testing. But the challenge is that, especially the challenge is highlighted by the COVID pandemic last few years, last 2 and 3 years. So the inefficient, some of the time we're waiting to get blood test result, and infrequent blood test results sometimes lead to the late diagnosis, and the lack of knowledge of a disease progression, and also some potential complication we don't want to see, which is also avoidable by using a new technology of blood testing. And also, if you got a chance to look at BBC News, I think last week, there's a news saying that during pandemic, so there are 50,000 cancer cases being undiagnosed, and also there are 25,000 cancer cases get untreated during the pandemic. It's really a different reason behind that, but one of the reasons is that it's quite risky for the patient to go to the GP surgery, do the blood test result, or maybe it's quite like a lot of burden to travel to the hospital to get the test. Also, it's not easy for the patient to get more frequent monitoring and also longitudinal monitoring for the immune system, or for all the different the key healthcare areas. So, and also the NHS also in the world. So we are having the digital first strategy and also digital transformation. So now it's really the good time and the right time for us to develop the solutions to enable the patients and also healthcare professionals to carry out their own tests remotely. Also, it's beyond the virtual clinics, beyond the virtual telehealth, and to see how if we could monitor our health and also the different type of the blood test outside the hospital settings, that will really speed up decision makings and also give very strong underpinning for the more personalized analytics at the individual level, rather than just a population reference of normal level, but in a more detailed granularity to look at the personalized health. So this is one challenge we really are very excited and also are very motivated to address through our network. So the idea of the network is really to build interdisciplinary, multidisciplinary community, because as you can see, so this will really involve a lot of expertise, including engineering, data science, ICT, medical science, and clinical science as well. So we have to work together to identify, to develop the future, for example, the remote, rapid, affordable, and inclusive monitoring and personalized analytics as a future vision of the future of the blood testing. And we will need to work with research, not only researchers, academics, but also with clinicians as well, patients, and also industrialists, because quite a lot of industry partners in our network give really good ideas to engage together to address these challenges. So this is the overall the aim and vision that we have. And we also have a conceptual view in our mind about what is the future blood testing approach, what does it look like in the future in general, and how could we guide our researchers to develop research. So in general, you can have you will be able to see the diagram we developed. So we would like to have end-to-end inclusive monitoring, blood monitoring, and also the personalized analytics, give a closed loop that provide monitoring at the non-clinical settings and with technology for monitor, and with data connectivity through ICT, and also the analytics and AI to give more decision support for personalized pathway or personalized treatment, and apply those conceptual ideas or the proof of the concept into our several exemplary clinical areas. And then, so in that way, we hope to give an end-to-end and also a closed loop as a future of our blood testing. So you might have seen these three red boxes. So these are the key three research areas in our network in the technology challenges. So that include the remote blood monitoring, a lot of engineering work in there, and also ICT, and a lot of IT and data analytics, and also the last bit is personalized analytics and AI. So those are three key challenges we are going to address. I will introduce in details later. So what we are in research is that the three key areas, and together with the clinical applications, we want to build new digital systems. Together they work together as a new digital system to support real-time or near real-time monitoring of self-management and timely intervention in the community health and care in a way that improve the healthcare and also help to support the hospitals given the limited capacity to improve the healthcare services. So I just give, because as Sammy said, this meeting is about our first launching call about the landscape report. So we have mentioned landscape report will cover some key areas of our network. So just give a brief ideas about what we want to cover in those key areas. The remote the first thing is a remote monitoring. So we especially remote monitoring outside clinical settings, laboratory settings, and which means we want to have a research about looking at the more portable and affordable devices that may include sensing or point of care devices, for the different blood biomarker identification in a high accuracy or probably have a low cost. And this, I think I can see this will be a very big research area because we have so many blood tests and we have so many blood biomarkers, and also the different aspect of the blood tests and blood biomarkers will come to a different, will lead to different research. So, so we're thinking to have like researchers in the, for example, imaging, the applied optics, and also biochemistry, electronic engineering, and many other researchers getting together to look at how could we develop remote monitoring in an at-home, portable, affordable way in the future. So this is, I think this is quite important area. And the second area is ICT. That is something we have been reading quite a lot because we've been talking about point of care devices, but one of the challenge for the point of care devices is the data connectivity. So we don't really have a very good data connectivity between the point of care as well as the healthcare system, and also the data standardization and the compatibility between devices is also an issue. Another thing is about the security, and because of personal data provenance, how could we ensure from infrastructure point of view to build this digital health system? That's another important area, but not limited to this area. So many other things. For example, another area I'm personally interested in is like a distributed learning. Can we apply like the current idea of distributed learning in a distributed way for blood testing? That's another idea. So, and the last technical area is the personalized analytics and AI. So this is something I relate to what I've mentioned earlier. Once we got a chance to have a longitudinal monitoring data for the blood testing results, for different type of blood testing results, we will be able to trend blood patient data over the time, because normally what we've been doing for blood tests is we only got data from a short, like snapshot, and it's not very frequent. You cannot capture the changes among the time, over the time. So what we really want to see is to develop the research around more adaptive analytics that can looking at each individual's as a blood value and see if we could have a personalized blood value, and also monitor those blood to give them more personalized, for example, triage or the alert systems. So that would be very helpful for the things like early detection or like treatment monitoring. So, and also how could we make things explainable and responsible in the healthcare applications. So again, it's not limited to those areas. So the many research, just give you some ideas. And we have fantastic clinical partners in our networks and supporting us to see how could we use the technologies in the healthcare applications. And we have already identified some key healthcare applications, such as early detection of the disease. Cancer is a key area because the cost of cancer treatment at late stage is really high. But if we could use technology to detect cancer early, and that through the remote blood testing, that'd be fantastic. And although some other like disease, like autoimmune disease, diabetes, and many other things. Another thing, as I mentioned, is drug treatment monitoring, and also clinical trials as well. For the clinical researchers, when you do clinical trials, we also need to help the clinical trial monitoring. And from the more operational and the process point of view, we can also think how could we streamline or improve the process, for example, reduce the time in the primary process in primary care, pathology, and all the different care services through using the new vision of the digital health system. And we were engaging with patient, supported by clinical partners as well. So this is the three key technical areas, and also clinical and healthcare application we would like to see, and also where to support the development in our development. And I think we have got really good international network consortium, not only from our core management partners, but also have international collaborators through all of the world. And I can see John's here, and from MIT, and also colleagues from Stanford and UBC and Hong Kong and Karolinska as well. And also you can see the clinical partners in some large hospitals in Warwick. I think Dimitri is here as well, and from Cambridge and the Royal Berkshire Hospital, Tony Borello, I think he's here as well, and from UCL and Imperial College London. Not only in the clinical partners, you can see on the right-hand side, we have at the third column, have companies involved really give very innovative ideas from Cambridge and from Sensa, and also, for example, Oxford Immunoalgorithmics. So it always give us really good ideas about what is the future we're looking at from industry point of view. And the last but not least, I have to mention is that there is a unique thing in our network is that we are a network of the networks, because everyone in our management team and also in the advisory board, they are coming from the different existing networks. For example, Cyclops, AI for Scientific Research, Sammy and Jeremy Singh, and also a tag where Mark is here, and also the other two Internet of Things and IT as a utility. So this is fantastic international network that will be able to support everyone in terms of the collaboration and to see who gonna have the implementary skills that you can work with. So the key deliverables in our network, we hope to run our network in 3 years and even longer. So we will see how things going. And by the end of a network, so what we want to achieve is a really effective, active community of the academics and the industrialists, clinicians. And we really have keep mentioning about co-creation, co-development. So we don't want to just like researchers working in our lab all the time, but we really want to have a co-creation and the co-development either with the clinicians or with the industry partners together, so that can like maximize the impact of the research. And another very important activity is the collaborative innovation projects. We will provide funding, but we will announce later this year that is really to seed fund the really good ideas that address the challenges, and also seed funds the research that can lead to the proof of concept, prototypes, and technological know-how, or even patent in the end. And some of the good ideas we may want to help you working together to apply for follow-on research grant application to make it more large and also more impactful. Another thing, so the third deliverable we want to achieve that is relevant to the topic today is a roadmap and the impact. So apart from the research, technical research, we want to do collaborative innovation project. We also been looking at the roadmap and the impact. How could we provide guidance for the researchers and policymakers and to achieve the future? Because it's not the future of blood testing where we envisage we cannot achieve within 3 years, but what we can do is to provide guidelines and a roadmap to help to accelerate this process. So what that Sammy will introduce later is we would like to work with you in terms of landscape report to look at the challenges, opportunities, gaps, and how could we achieve our vision, and what is a roadmap look like, and how we help all the rest of the community to achieve that vision. And also high influencing publications in the journal and conferences. And again, we want to emphasize, we want to achieve impact in the real life, change practices and processes. And another thing and our focus is early career researchers. So we obviously really bright talent, and in the in early career PhD and postdoc researchers, they got really good ideas. And we would like to support early career researchers and give them a platform that to networking, and also give the opportunity to do feasibility studies as well. we want to support them to have more development from early researchers who got really get good idea and further develop from our network. And to achieve those deliverables or outcomes. So as you already see that landscape report we're going to do, so Sammy will introduce network workshop. So we will have some about 2 or 3 large network workshop. So we are still thinking, should we do the face-to-face or online this year, but we will let you know very soon. Just really, we want to create an event and also the vehicle that's people can meet each other and then come up with good ideas and work with each other and for some to address some challenges. So we will announce our plan very soon. And online seminars, we are also going to plan to have very soon. So on the on the online seminar also be recording on the YouTube, so everyone can have access to it. If you have any ideas you want to present your research, feel free to let us know. And project we are going to have already mentioned, and also we are planning to have working with international conferences as well to have our network with one of the research track in the key conference in different area in information system, in biomedical engineering, or even medical science conferences, and to encourage researchers to present your idea, to get idea published proceedings. And again, so long-lasting work, research and impact development. I don't need to mention too much. So that is the key activities and deliverables and key areas of our research. And you feel free to get in touch with us. I believe Sammy will mention details of our how to get in touch later. But this is our contact ideas, our contact informations. So I will hand it. So that's all for my presentation. And I will hand it over to Sammy.